cost. Prepositioning, you need to think about the cost. Is this something I can afford? How much money do I have? How much of a stockpile can I afford to keep? Okay, so just to share with you internally what we have on our shelf, in our warehouse in Nairobi, we have 317 distinct items with a total value currently as at today of $9.7 million. And we have units of goods, 3.3 million units of goods. Then for us, based on the disease profile of WHO, this is what we are pre-positioning. Things from ambulances, and I think this is by value. Hold on, let me find a way to remove this. Yes, so this is by value. We have, of course, vehicles, because we don't have to wait for the ambulance, for the need for an ambulance to come before we send the ambulances. We also have a respirator mask for the oxygen supply. We have some COVID RDTs, integrated health kits, patient monitoring devices, ventilators, tents, PPE, of course. So this is what we have on our shelf. So as my Pam just said, our program area manager for operations support and logistics, we are blessed to have opening this webinar today. You can contact us through the country office if you need any of these goods. You can contact us through the country office and we'll be happy to supply. We also have fast moving inventory. This is another thing. You look at what goes out often. That is a factor to determine your pre-positioning. I just wanted to share with you data, because supply chain is all about data management. I'm told that every day, actually. So the fastest moving item for us are lab and diagnostic supplies. Then we have health emergency kits, which WHO is a leader on, integrated emergency kits, the trauma kits, the cholera kits, the test kits for Ebola, etc., etc. Of course, PPE to keep the health workers safe, vehicles, and pharmaceuticals. Then our outbound description, also, you can see the RDT, what have we shipped out? It kind of matches what we have brought in. So you can see that there's a lot of trend analysis happening here. This is also something we are very happy to help you with, to look at the quantification, your past numbers, and how can we come up with the right stockpile plan, prepositioning plan, and also what is needed? What are the health facilities asking for? So for us, in our case, again, our number one stock, if you remember, was RDTs. It's also the highest thing that's gone out. We've also had a lot of ambulances go out, again, integrated health kits. Something interesting, peanut paste. This is a malnutrition paste, especially with the Horn of Africa food insecurity crisis. And this is a beautiful map of our lovely continent that shows where we've sent things to from Nairobi and what they've been supporting. So I just didn't want to just come to you with stories, but I wanted to demonstrate how we are a proving testament, as Adama said, that stockpiling works, pre-positioning works, and there's a need for it. Again, we can keep showing you graphs. We love data. This is our outbound activity. The earlier slide broke it down. This is just the big picture. Out of our warehouses, we've been keeping some things with WFP in Dakar, which we're moving in Accra, which we're moving to Dakar, and also Nairobi. Out of our 47 countries that fall under Afro region with WHO, even though Africa has 54 countries, some of them are under the EMRO region. We have been able to support 44 out of 47 countries with 204 shipments in 1 year at a total outbound value of $12.9 million and 5,000 tons. So you can see there's a lot happening. The CBM is 5,400, metric tons is 874,000, okay? And we've supported Malawi with their cholera, and also some COVID-19. Kenya is our second client. You will also be hearing, I don't know, do we have Dr. Kamene online? Also, I'd like her to tell us what we have done for Kenya. What is Kenya doing for prepositioning, and also how we are supporting them? If she can just jump in for a minute, introduce herself and give a little bit of country, member state perspective.
Thank you, Fatima. Dr. Kamene is on call. Dr. Kamene, kindly introduce yourself and give your brief talk and discussion of Fatima's presentation to your audience. You're most welcome.
Thank you very much for this opportunity. My name is Dr. Kamene, the Acting Director of Public Health and Sanitation in the Ministry of Health in the State Department of Public Health and Professional Standards. This is a great opportunity to join this meeting. Excited to have listened to her presentation. Thank you very much, Fatima, and the discussion of prepositioning of commodities. So we, as a country, are privileged to host the WHO Regional Emergency Hub. And I've also been privileged to have worked together in the establishment of the hub, looking at the clearance structures and other factors that have led to where it is today. I'm glad and privileged to be in that team. So we have worked a lot and have benefited, as Fatima has mentioned, from the emergency hub greatly. Kenya has gone through a number of emergencies in the last, at least while I've been in office, for the last 6 months. We have had cholera outbreaks, we have had polio outbreaks. We are anticipating flooding during this El Nino and rain period. Already we have lost a number of lives and a lot of families have been displaced. So we have benefited from WHO in a number of ways. One, they have supported us in capacity building, a surge capacity that has been ready whenever we want to respond to emergencies. So the first surge capacity training has already happened with over 120 people trained. In terms of cholera commodities, we have been dependent very highly on WHO. Our requests have been on time and have assisted us to end a 1-year-long cholera outbreak that started last year in October, and we were able to clear it. Now, during this period, we get to clear that. The other benefit that we have had from this WHO emergency hub, as you're aware, most countries will most likely not be ready. As we speak, in our store, we do not have any stocks as a country for emergency stockpile. And we have realized that we are rarely ready whenever an emergency comes to handle any outbreaks. So what we have done is that we now are learning from WHO on how to prepare in advance. By the time our contingency plans are approved, we are already in the event. So most of the time would be late. So we are now working on coming up with proper forecasting and quantification for emergency stockpiles. What are the most necessary and urgent stocks and commodities that we must have? One of the areas that is very key is diagnostics. In our last cholera outbreak, we were only able to confirm 5% of the cases because of our lab capacity, lack of reagents, meaning we were not ready. I believe most countries have also had a similar experience. So now we are learning how to put in measures like forecasting and quantification. The other area that has been a gap, of course, is having qualified or expertise in the quantification of particularly laboratory commodities. Now we are targeting to improve on that because that also, of course, has been a big gap. I'm glad to have learned about this in terms of risk assessment. We have been working with the high-risk counties, particularly for our quantification of our needs. And so far, with the support of WHO, we have done well with polio campaigns. and I'm sure we'll also do very well in the floods during these flood times. So I don't think I want to add more, but if there are specific questions, I can be willing to
Sure.
contribute.
Thank you, Dr. Kamene, but stay with me for a bit. Let's have a little bit of an interaction. So you heard it from Dr. Kamene. Kenya has supported us very, very much, significantly, with the easing of the procedures for bringing in goods for importation. And also, you know, just a lot of support, financial support, giving us land, etc., etc. But essentially we are their back office stockpile, and we're happy to have that position and that role. But Dr. Kamene, can you talk us through how, when you know there's an emergency coming, how do you request supplies? You talked earlier about quantification. So once that quantification is done, what routes do you go through as a ministry to get to the hub and to access our supplies? How do you put in your requests? And also, how long has it been taking for you to get a response from WHO?
Okay, thank you very much for that question. Our requests come through the Ministry of Health to the WHO country office, from the country office to the WHO hub. And we must admit that our timelines have been very short. Our response for cholera is, for example, in Nairobi and most of the counties that received cholera supplies were really timely. I must admit, for example, with this time when we're anticipating El Nino, even as we think about when we are going to start having El Nino, WHO has already distributed the commodities and emergency supplies to the counties on our behalf. So as a country, we are ready because of what WHO has been able to do for us, the WHO hub.
Thank you, doctor. Thank you, doctor. So you see, audience, basically the point I wanted to come out is we are an enabler, okay? We're at the back. You need us, we're there for you, like UN Amazon. So what typically, if you're in a Ministry of Health in any country on the continent that we cover, you go to your WHO office and you put in your request. Of course, these requests have to be directly linked to a graded emergency, because we are an emergency, not routine. And number two, the WHO office has to provide funding. You don't go to Amazon when you are broke. You go when you've been paid your salary. So we need to make sure that when these countries are developing their work plan, you work with the ministry to ensure that emergency response and supplies is in there. That's how we work. You come to us with your well-defined needs based on your forecast, and we are happy to support. I will later on, I'll talk about the future plans, but that's how it works. We're very happy. This is what we're there for. 1 second. Okay, let me move to okay. This is my last slide. Like I said, we're action people. We prefer to show than to talk. So here we have the emergency preparedness and response plan, which, you know, WHO has developed. It's online, and you can, these are some links we will be providing to you. You can go there and see what's in those documents. There's assistance with quantification. If you put the target population, it can show you what kind of goods you need, the quantity. You can see there's an essential items estimator here. So WHO is working with different actors in this humanitarian space, UNICEF, MSF, etc., etc., and trying to help you with your quantification. If you need quantification support, we also have a quantification team by disease profile. You can go through your country offices and come to us, and we're here to help. So I leave you with a beautiful picture of our warehouse. If you are in Nairobi, Kenya, and wish to visit, also, we're happy to show you around. We believe that we believe in the gospel of supply chain management in terms of adopting of best practices in forecasting, procurement, inbound coordination, warehousing, and last mile delivery distribution. So we are here for you. All you need to do is just knock on our door. With that, I hand over back to Dr. Otto, and I'm happy to answer any questions, but keep them easier.
Thank you very much, Fatima, and thank you very much, Dr. Kamene. You have some little time and you can respond to the questions. Some questions are being typed direct on the chat, but there is a question from one person whether this is just a pool procurement mechanism or whether the hub is just acting as a warehouse. Probably this is targeting other roles of the hub. And then the other question was whether government can channel funds through the hub, or it's just a WHO for those within WHO. And then the other question is, why not support every country to preposition other than depending on the Nairobi hub or Senegal? And lastly, is there any WHO guidance on ensuring quantification for logistics in emergencies? Is there a guidance document? So please, you can be supported by your team members and other panelists from the hub to answer these questions. Thank you.
All right, thank you very much, Dr. Otto. I start with the pull. Yes, we don't push. We do not push. We strongly do not push anything. We are a pull system. You come to us with your quantified needs and we send it to you. Why don't we push? Because we've been pushed enough. People, sometimes our continent, let's be honest, sometimes you feel like they dump things to us that we do not need. We respect governments, we respect their professionalism and their ownership and accountability to their citizens. The government comes to WHO, they say we need XYZ, they pull from us. We don't run a push system at all. That's number one. And yes, we are also a warehouse. We warehouse for WHO operations. Right now, Kenya country office we are co-housing their supplies within our warehouse. We have bin locations for Kenya country office supplies. So it's a warehouse and stockpiling operation, I like to call it. Then for government channeling funds through the hubs, we work with the country offices. The WRs will speak to you shortly, our WHO representatives. We are there to support them. You go to the WR. If you need technical advice on prepositioning, we are happy to help. I'm sitting here in Sierra Leone. I've said it now 3 times. And we are providing assistance on technical areas that we have expertise in. Our director said the same thing earlier. You come to us, you need help in quantification, forecasting, warehousing, last mile distribution, CONOPS, concept of operations. We are there to help you through the country office, okay? Then WHO guidance on quantification, yes, it does exist for certain disease profiles. I mentioned earlier, I'll go back here to the previous slide, if my computer agrees here. These links, you can find, there's a global task force on cholera control that has a quantification tool, and you have quantification tools for several other disease profiles. You can see them. One thing we are working with Africa CDC on a joint emergency action plan, specifically for logistics, and we're working on a specifications library and also a catalog, so that you can go on there and say PPE N95 and it shows you the detailed specifications. That's something I'll be talking about later in terms of next steps. There are lots of very exciting things happening in the pipeline, which I'll be able to discuss later. So Amarachi is telling me there are 2 hands up. Moderator, can you help me? Dr. Otto, over to you.
Yes, thank you very much, Fatima, for answering the questions. There's just one. As I get the people who are hands up, we could have somebody answer whether we use the disease profile of countries to undertake effective prepositioning. Do we use the disease profiles, the epidemiological information?
Yes, we do. As earlier I mentioned risk mapping. So we are an enabler to emergency preparedness and also response. So our WHO emergency preparedness colleagues are here with us today, and also the response colleagues. So we knew, like Dr. Kamene mentioned, El Nino prepositioning. So when El Nino had not yet started, we were just hearing about it, but all of a sudden we really increased, purchase of those specific items we thought could be critical in if there's such an event. So we don't wait for the event. If you wait for the event, you miss the event. Prepositioning is all about planning based on trend analysis and risk profiling. Over.
Thank you very much for your presentation and answering the questions. I still encourage members to put in the questions on the chat. I would like to invite Linda Makayoto from Rwanda. Kindly introduce yourself and go ahead to give your presentation on your country experience. You are most welcome, Linda.
So good afternoon, good morning, colleagues. My name is Linda Makayoto, the emergency team leader based in the Rwanda WHO country office. And I'm here on behalf of my WR, the WHO representative to Rwanda, who was supposed to be part of this webinar, but due to an urgent engagement, is unable to join us. Okay, I would request the person who's still sharing to stop sharing the presentation so that I can share mine. Thank you. Yes, so I will share our experience of an emergency of floods and landslide emergency that we experienced earlier this year in May. Of course, focusing on issues about logistics management and prepositioning. So on the country context is that Rwanda is a small country that is located south of the equator in the eastern central part of Africa. It has a population of around 13.2 million persons, with the majority of persons, 72%, living in the rural areas. Rwanda is also called the land of 1,000 hills, and this is due to its very hilly terrain. And this very hilly terrain makes it prone to landslides. The country experiences or has two rainy seasons: the long rains, just like many countries in the eastern part of Africa, which starts in May and March to May, and then the short rains, which is the current season that starts in September to November. And with the climate change effects, we're also experiencing this. And this sometimes results in unusual heavy rains. And when we have these very heavy rains, there's flooding. And of course, because of the hills, we get landslides. So as I alluded to before, on the night of 2nd to 3rd of May, we had very heavy rainfall on the western and northern parts of the country. The western parts are the areas that border DRC, and the northern parts are the areas that border Uganda. So these very heavy rains and the landslides led to a widespread destruction of infrastructure, including homes and also transport infrastructure, the roads, bridges. We had power cuts, and water treatment plants were also destroyed, and some of the health facilities experienced also some destructions. So this emergency resulted in over 18,000 persons being displaced from their homes, with more than 100 people getting severely injured and had to be evacuated and taken to referral hospitals for management. And unfortunately, we lost 131 lives. So when these persons were accommodated in these in camps, as the health cluster or health working group, there were some public health threats that we were anticipating, and we had to get prepared for to respond to. So there were some disease outbreaks we're looking out for. These are diarrheal diseases, including cholera, and then vaccine preventable diseases like measles, vector-borne diseases like malaria, and also because of the flooding, we were also looking out for Rift Valley fever. Then, of course, the chronic non-communicable diseases. Some of these persons had hypertension, diabetes, pulmonary diseases, which we needed to support and ensure that they get their medication, gender-based violence, mental and psychological health disorders, malnutrition in children, and also an increase in maternal and neonatal deaths due to the inaccessibility to health facilities for those who are still at home, and also maybe the health, maybe not optimal health services within the camps. So how was the response coordinated? The response in country was led by the ministry in charge of emergency management, commonly called MINEMA, and a national command post was established with an incident management system. So similar structures were also established at district level and chaired by administrators, that's governors at provincial level, and also mayors at district level, working, of course, with the technical officers from other sectors. On partner coordination, some working groups were established by sector. There was one for health, which was led by the Rwanda Biomedical Center, which is the National Public Health Institute of the country. And it bundled many partners who are supporting health, issues about WASH, nutrition, sexual and reproductive health into this one sector. So specifically, what was WHO's support to this response? When the emergency happened, we quickly supported the RBC, that is the NPHI, to develop the health sector component of the response plan. With support from AFRO, we were able to conduct the initial public health situation analysis. And because we really needed some funds to have some stockpiles at that time, we repurposed some funds at country level, which had been earmarked for other activities, and were able to purchase some or procure interagency emergency kits from the Nairobi hub, and also some tents to quickly come up with the health facilities to provide services, especially in the camps, and also deploy WHO country office technical staff to support the response. Then concurrently, we sent a request, an SOS to AFRO to help us with additional funding support, and we received 30,000 to support the response. And then additionally, also jointly with other UN agencies, were able to successfully apply for the Central Emergency Response Funds. So the country received $1.5 million for 3 agencies, with WHO receiving 400,000 for health support. Then Rwanda is one of the countries that is already implementing the EPR flagship initiative, and we have a team of 75 multidisciplinary officers drawn from various sectors for their voxage. And these trained members, I think around 66 or 60%, 50 of them were deployed to support the response. And the 8 vehicles that were donated as part of the flagship initiative were also very useful for the support. So for the initial procurements that we did, we had a lot of procurement. Our first, the point of call was to ask for these supplies from the Nairobi hub, and maybe share our experience with how the Nairobi hub team carried itself during this response time. So when we contacted them, they were very supportive. They provided us with the catalog or inventory of what they had, and also, of course, with the costing, provided us with the guidance, or rather guided us with on how to quantify these supplies in relationship to the magnitude of the emergency that we had, and also the anticipated duration of this emergency. Then immediately after we made our order, they promptly dispatched what they had in store as they supported us to source additional supplies from the Dubai warehouse. So just a comment on the timeliness of reception of their supplies. For the first batch of supplies that we got from the hub, we placed our order on 6th of May, and by the night of 10th May, the supplies had arrived. And then the second batch came 20 days after the order. So what were some of the challenges and gaps that we had during this emergency? Due to limited funding, we were not adequately prepared because there was inability to maintain some of the stockpiles and also unable to position for likely hazards. We also had some delays in procurement of additional supplies, which we required at that time. There was a mechanism which was suboptimal for partner coordination, and this also affected information sharing. At subnational level, we had insufficient human resource, particularly to support logistics management, and this affected the response. The country has an electronic logistic management information system. However, the system is used to manage routine stocks, but they lack a module to support management and tracking of emergency supplies. So this also affected the logistic management during these emergencies. And maybe just as a general statement is that healthcare supplies chain is very complex, and trying to manage it during a crisis just makes the complexity even more compounded. So of course, it was not all doom and gloom, but there were some good practices that emanated from this response. Government level, there was very strong leadership, and a whole of government approach was actually used. All sectors were involved, and this led to an effective response. And I think within 1 month, the camps were already closed, people already resettled back to their homes, and things were already back to normal. Again, because of the very strong collaboration and working relationship that WHO has already had with the Ministry of Health. So when the emergency happened, government was not very keen on partners going to the field, but because of this very close collaboration and the trust that they have bestowed on us, our WR negotiated with the minister, and the country office surge team, the experts, were able to be embedded with the MOH field teams to support the response in the most affected districts. At UN level, there was a joint, we submitted a proposal for SAF funding, and we successfully were able to get the 1.5 million and this US dollars, and this bolstered government response efforts. So what were some of the lessons we learned as far as supply chain logistics management was concerned? Is that there is need for health emergency preparedness planning and also operational readiness in all countries. And we must include a critical element of supply chain management. Then we also thought that effective stockpiling and stockpile management actually is what actually enables us to have a rapid or immediate response. So this is a critical component of it. And then we cannot overstate the importance of having logisticians as part of the emergency response teams, of course, both for the partners and also within government. Then finally, the need to streamline custom procedures to ensure that it is expedited clearance of some of the supplies when we have an emergency and don't have any delays because of the complexities at the customs. So based on the experiences from the flood emergency after the after action review, at least it has borne some fruits. Under the UN resident coordinator with support from the regional OCHA office, we have been able to establish a disaster management coordination mechanism to coordinate partners in Rwanda. Also at the level of government, MINEMA, they have now expanded the working groups adopted the cluster approach, which now has separated and included health as a critical component, education on its own, WASH, logistics, trying to mirror what happens in humanitarian emergencies. Then for the health sector working group or the health cluster, this has been created and it's now being chaired by the Ministry of Health and co-chaired by WHO. So what are some of our recommendations based on our experience is that we would like to encourage countries who have not conducted their risk assessment to do so, and also develop their risk calendars and use this to enhance their preparedness planning, especially on this supply chain management and stockpiling and strategic prepositioning to be able to be ready for health emergencies. Also, training and simulation exercises should also be conducted as an integral component of preparedness plans. Of course, include issues about emergency supply chain protocols, test these protocols also. And then countries should also establish emergency kitties and use this with some expedited protocols to ensure release of funds and availability of funds to support emergency response when they happen. For us, the stockpiling at regional level, I think it's a great initiative, and we think it should be strengthened to ensure rapid response for emergencies in the region. We think that it's more cost effective as it covers several countries, and it's also a stopgap, especially where local capacity to manage some of these stocks is not sufficient. But at country level, be able to maintain a minimal amount of stockpiles, which you can begin with, of course, guided by your hazard profiling, and even as you wait for the stocks to be shipped from the hub. Then encourage also countries to establish the role of these health logistics officers within our health management teams, have logisticians in place at all levels to help us manage these stocks and also track and also involve them in both preparedness and response. And then countries should also develop robust logistic information systems for emergency resources, in addition to what they use to manage their routine medical supply chain. And then last but not least, be able to document the lessons that we have learned during some of these public health emergencies and use them to update our plans and of course strengthen preparedness and response in the region. Rakoze, thank you very much.
Thank you very much, Linda, for sharing with us your experience. And critical to note here is that within 4 days of ordering, you had been able to get your supplies, but also we note your challenges, HRR, and the tracking mechanisms. But key we have learned from you is that leadership is very vital, including the negotiation skills. And at this moment, I would like to give you a minute or two if there are any critical issues that you want to address from the chats, but also we'll give Fatima and colleagues some 3 minutes to address critical issues from your presentation. You are most welcome. There are many participants. These questions will help to clear backlog of questions and not to come at the end. Yes, Linda, any issues before Fatima comes?
Okay, I've gone through the chat. I've not seen any questions specific to Rwanda.
All right. You are quite busy. You have another Q&A session at the end of the presentations. Fatima, please come in.
Thank you very much. And big thank you to Dr. Linda. Much appreciated. It's nice to hear from the clients. So Linda's presentation made me think about 2 things. One is the KPI for the warehouse is the 3 days comes from picking, packing, and ready to ship, okay? Dr. Linda also mentioned green light. What does green light mean? Green light means go. So for us, we pick, we pack, and it's ready to be shipped. Then we need to wait for the country to tell us you can bring it in. Why? out of our 47 countries in the region, more than 20 countries have a green light procedure, which means you have to get regulatory bodies approval to bring things in, especially medical category goods. Dr. Linda also mentioned that one of her challenges are streamlining of customs and the green light process. You do not wait until you need to bring in morphine to start telling your regulatory bodies, I'm bringing in morphine, which is a narcotic in any country. So I love what was done in Rwanda. What did Rwanda do? They actually negotiated with the government to incorporate logisticians into their operations and make them sit in the office. So that collaboration and communication is there. They also we're working very hard to negotiate that during declared emergencies, these waivers for imports are given. This is also excellent. You have to think about logistics as a tool for you to effectively respond to emergencies. That's my submission for now. Thank you. And back to you, Dr. Otto.
Thank you very much, Fatima. There are questions of why the hub in Kenya, why not DRC, and then how does the hub work with other agencies, like other UN agencies? So,
okay,
maybe invite
so why Kenya? One, access to port. Port Mombasa is the most active port in East Africa. We need access to the port. Two, temperature. Earlier, I spoke about temperature control requirements. Most medical category goods, at least 90%, need to be stored in ambient temperature, 18 to 25 degrees. This is the natural weather in Kenya. I don't need to have a special temperature. I just have temperature monitoring, except for the cold chain, which is about 5% of my portfolio. So you see, and then three, strong support of Kenyan government. We actually have a blanket customs clearance in Kenya. I have direct access to the Pharmacy and Poisons Board for clearance, to the customs for pre-shipment clearances, to everybody. Kenya Revenue Authority with the exemptions, they have given us a speed lane, expedited lane to bring things in to support the continent. Those are the top three reasons. However, we're also happy to have stockpiles in other places, small strategic stockpiles. If you feel that for whatever complex reasons you have, you can come to us and say, I need you to help me come up with a strategy for prepositioning. I also see a question from DevX. Can you explain how the hub reduces expiration? Basically, we run a rolling stock as explained earlier by Adama. Our stock is rolling, which means if I have Dr. Nima's stock, WR of Malawi, who is on next, and somebody tells me, hey, I need XYZ, and I know I bought it for Malawi, I can talk to Malawi, do you need this now? No, I send it to South Sudan. So your stocks will not expire. I still have $200,000 worth of stock for her, but we can keep ordering. The stock is rolling. So because I am supporting and people are pulling for me 47 countries, I am managing expiration. Nothing has to expire because we are using, the stock from on our shelf to respond, and then we kind of have a kitty. We have negotiated with WHO, Afro, and headquarters to give us an account that does not expire. So when you give us your money, you don't have to care about the end of financial year or end of biennium. Your money is with us, and we give you the equivalent in stocks when you need them. Just talk to your WRs and come to us. Over. My 3 minutes are up.
Thank you very much, Fatima. We have the hands of Dr. Miriam Nanyunjahab, the hub coordinator. Kindly, Miriam, come in.
Yeah, thank you very much, Thank you very much, Emmanuel. I wanted to highlight one issue that Linda talked about, and the issue of keeping a minimal stock at the country level for you to start off with. That is also another form of stockpiling, could be at the national medical stores or wherever, as you wait for this 3-day transportation from the hub. But don't keep so much because it gets expired. So just keep little, and you could put most of it at the hub, given the explanation that Fatima has just given of how they avoid expiry. But good to have something. If it is Ebola, you need PPEs for day 1 or day 0. So you need to have something small to start off with at country level as you make your order for what you have prepositioned at the hub level. Over.
Thank you very much, Dr. Miriam, for that guidance. I would like to call in the country rep from Malawi to give us the country experience, to give us their country experience in preposition and management of logistics. Kindly, you will introduce yourself and other things that you'd like your audience to know about you. You are most welcome, WR.
We are not hearing WR.
WR is muted. IT, kindly.
It's that one.
No, it's the one on the table.
Where were you sitting?
Emmanuel, please, WR has rights to speak. I can see that she's on mute and her video is on. If you could please call her attention.
Yes. It is not the one, but I think it can help. It is not the one.
Dr. Nima, I can see that you're unmuted. Can you please speak? Dr. Nima?
So, maybe as the WR comes, we would, the team that has been taking stock of the questions could come in to answer some questions from the chat. This will help us to save on time and for the Q&A. So colleagues from the hub and panelists who have questions, this is the opportunity. Perhaps we would start with the OSL team.
Okay, let me jump in quickly. There was a question. My name is Alex Freeman, part of the Nairobi Hub OSL team. There was a question in regards to South Sudan be an insecure country. How can we have a stock preposition? South Sudan is one of the countries that can really benefit from the Nairobi Hub because there are regular flights between Nairobi and Juba, and also road networks where supplies can reach to South Sudan. And from my past experience, we even have in a case where supplies from Nairobi were directly flown to Paloch, close to Malakal, where was delivered straight to where the need is. So I think South Sudan is one of the countries that can benefit from the Nairobi Hub. And just to add on the previous presentations on the importance of using the hub, it also helps you to save on your holding cost, because countries have a huge warehouses which is being charged per square meter. So you find out that you are paying on holding a huge supplies and also risks of expiry dates. So as Dr. Miriam and colleagues have mentioned, minimum stock, and then your stocks will be held at the Nairobi Hub. That limits your holding cost and also reduces your expiration of drugs that you need to spend more now to do destruction at your country level, as my colleague Fatima has already mentioned, that the hub is running a rolling stock. So the holding cost also is something that countries should currently look into, how they can reduce on huge warehouses and on the holding cost. Thank
you. I see Dr. Nima, the WR is on. Can you come in now? Dr. Nima, are you on now? Yeah. Okay, as we get the IT people to sort out the connection issues with WR Malawi. Wow, I'm told she's speaking and she cannot be heard. So can somebody reach out to the WR? Meanwhile, we have meanwhile, we can have somebody from the team to.
Emmanuel, as WR comes on, I can share a small experience. The issue of linking stockpiling to risk profiling. Before we had the Nairobi Hub, at country level, we did the risk assessment and tried to do stockpiling based on the high risks that we're likely to face. And we went through all the things that they are mentioning. We had to hire a warehouse with the World Food Program, and we kept our stockpiles there. Managing the stockpiles, big stockpiles, was another challenge that we had to deal with. But also, you can anticipate some risks or hazards, and they may not occur. So we had an issue like that, where some did not occur, and we faced an issue where things were almost expiring in our warehouse. And we had to quickly donate to the National Referral Hospital that could consume them in a very short time before they expired. So now that there is a regional hub where we could put some of the stock, I think that this would limit the amount of space that you need at the national level, but also it can limit that risk of expiry, so that when you need supplies, they are available for you. I just wanted to share that personal experience or country experience to encourage the other teams from the member states. Over.
Very much, Dr. Miriam. Alex, your hand is up.
Yeah, just to come in again, one important point that Mr. Adama emphasized on the opening. From experience, you find out that many countries have money that is getting expired, or they try to procure at the very last minute, where some of the procurement processes will not allow the approval because of the expiry date of the funds. So using the hub, and as it has been mentioned already, also limit some of those risks, that you can send those funds to the hub and those supplies can be procured and staged there. So it also limits the risk of countries losing funds at the end because of the procurement processes and then the approval of short expiry dates of funds. So I think, and there are a couple of experiences on that on different countries, including where I'm now currently, Ethiopia, and also Malawi. So I think EPR team leads on this call can take advantage of the hub to ensure and to utilize these resources with the open funding capacity that the hub have to utilize some of these funds to stage supplies for them that they will need for their response. Thank you.
Yes, thank you. Thank you, Alex. I see the WRA is now on, and you seem to be.
Can you hear me now?
Yes, WRA, we can hear you loud and clear. Sorry for the technical glitch. Kindly introduce yourself and the professional profile for your audience to know, and then go ahead to give your presentation. You're most welcome, WR.
Thank you. Sorry, I've had issues with my laptop and I'm taking it from my phone now. So anyway, I also have, unfortunately, very few minutes, because I had expected that this meeting would end at 1, and I have a critical meeting that I have to attend in the next 10 minutes. So what I would prefer is just to speak through and not actually use the slides, and I think they can be shared later. So just to say that Malawi, particularly this year, has faced the worst cholera epidemic and also the worst cyclone. And we've learned a lot of lessons from this. It was a huge operation that needed a lot of supplies, a lot of surge staff to be able to manage. Malawi had the cholera started in 2022, and the country has had over 59,000 cases, and earlier this year it was up to around 700 new cases on a daily basis. For the cyclone Freddy, we had a very bad outcome in terms of with over 600,000 people being displaced and over 600 deaths and about more than 500 people unaccounted for. So actually that means about 1,000 people died as a result of the cyclone Freddy. So just go straight to some of the challenges. I think there's a lot of similarity with issues that were mentioned by Linda. I think one, in terms of the emergency preparedness stock, we had to some extent done some preparation, but it was inadequate in terms of the amount of supplies that were needed. And then when it came to the supplies for Cyclone Freddy, while we had information from climate on the possibility of the cyclone, I think the cyclone had passed at one point and only hit Madagascar and Mozambique. So there was a certain level, I should say, of like passivity, and maybe it won't happen this time. And when it did hit, we had mudslides, which the country had not thought about at all, and there was a significant number of trauma cases. With the floods, even if we had the supplies at national level, the issue was how do you reach the areas that have been affected because roads had been cut off. So then it really brought the whole essence that yes, you need to do the quantification. You need to have the EPREP stock at national, but you also need to think about subnational levels, meaning that you need to think clearly about when you have these disasters, there are some areas that you'll not be able to reach quickly, so that you also have stock there, because otherwise it reached a point where we were fighting now. There were a few helicopters. The same helicopters are supposed to take food, they're supposed to take medicines, they're supposed to take supplies, they're supposed to take political people who are going to see those people who have been affected. So in preparation, you really need to think of the whole supply chain actually during the emergencies, and in the risk assessment to see what areas you are likely not that you won't be able to easily reach, and make sure that we have some systems in place for warehousing in those areas. I think the other thing that was mentioned by Linda was the issue of the human resource, the whole operation, having someone for operation, support and logistics. I think in many country offices, it's just been like the procurement person who, and even if you have someone who's responsible for essential drugs and medicines, I think the whole operations and logistics during emergencies is a whole different scope. And it's an area that we need to build capacity, whether we have people dedicated, if we have regular emergencies, or if not, then we need to make sure that people are capacitated on the specifics of OSL during emergencies. I think the other thing, of course, in the EPREP stock is the whole issue, the time that it takes to get things in country. If I compare, like in 2022, maybe before the hub was fully set up, and what we got in 2023, it really helped that with the hub now we could have things coming in from Nairobi, even some things by road. But even if you need to charter a plane or bring things by air from Nairobi to Malawi, it's significantly cheaper than having them coming in from Netherlands or Dubai or elsewhere. I think the other things that were also mentioned by Linda, which are important, when we plan, it's not just like to plan as WHO, but also to look at the whole needs, to do the quantification, and then to have all partners looking at the supply, and so that you have visibility of the whole picture. Because sometimes you may have different partners here and there having some supplies, but then you find there's replication, and then there's some critical supplies that are missing. So really having that national plan, and then having all partners falling into that national plan, and having a technical working group or a pillar that actually meets regularly and looks into the whole picture of supplies is very useful in terms of ensuring that all the critical supplies are met, but also for the donor visibility. The other thing that maybe just saying some of the things that we are looking at, or maybe one other thing that I want to raise that also Linda raised was the supply chain systems. In many countries, you'll find maybe it's the ELMIS, which is for the routine medicines and does not have a system for the emergency supplies. So tracking the emergency supplies, tracking what is available at the lower level also becomes a challenge. Accountability becomes a challenge. In Malawi, we had UNDP had supported the they call it EHIN, which is like for emergency supplies, but still the actual entering of data was a problem. And I think this is an area that we need to strengthen across. And then also we learned that it helps to have some sort of audit of supplies, to go and check with the supplies that have been sent when it's emergency supplies. How have they been used, so that people know that there is some system that is tracking accountability of supplies. Otherwise, we may end up having we think supplies are going to the people in need, but actually there's proliferation on actually prepositioning of supplies. And in that system also, we are now looking at where are the different places where supplies can be need to be prepositioned. We've done some hotspot mapping. We're looking also at the emergency supply chain for logistics. You need to think of it well ahead before the emergency happens, because the last mile delivery may need more than vehicles. It may need boats, it may need air. So all that needs to be taken into consideration. So we are working with support of the hub. We are prepositioning some supplies at the hub, ORS, IHE kits, and we are also looking at what supplies need to be prepositioned in the country. As part of our surge training from the flagship, we have also included people from Malawi Defense Force. So we're also looking at how can we use the Malawi Defense Force personnel also and systems to support health logistics and emergencies, because they're very good at that. The country has also passed an emergency act, and this enables to expedite systems within the country for the country. So this will enable them to be able to jump some of the normal systems and requirements for procurement, so that they are able to do quick local procurements when they have the money to fill in certain gaps. So I think I'll stop there and be happy to take a few questions if time allows. Thank you. I'm supposed to be going into another meeting, but yeah, maybe I can take one or two.
Thank you very much, WR, for the very wonderful sharing of the experience on cholera and Cyclone Freddy. And we're happy that we are beginning to reap the benefits of having the hub nearby. This has come both from you and from Rwanda. Things are getting to the countries a lot easier and faster. So, we can, there are no very specific questions for you, but we can have them very quickly on the chat. If you want the WR to respond to some specific issues, kindly put them on the chat. Okay, this also takes us very specifically to the Q&A session over the next 10 minutes. So the panelists kindly come in and answer questions specifically on areas where you want to respond. There are a lot of questions on the OSL team. There are questions on vaccines. There are questions on the hub itself. So colleagues come in.
Emmanuel, there's a hand by Freeman.
Yes. Freeman, please come in.
Okay, let me just touch on some of the stockpile because you know, when we talk of stockpile, people always think about just physical preposition, like the question related to the vaccines. Having initial agreement, taking like the example that was mentioned about Rwanda, like getting the clearance from the government. In relation to vaccine, also having an agreement with the manufacturers and also ensuring that they will be able to produce and have it delivered within a short time. That agreement is also part of the emergency preparedness. So it is not, it is not necessarily that if we talk about stockpile, it's only the physical stock, but there are other mechanisms that also support the stockpile, like items with a very short expiry date that you don't want to have them and that you will not use and expire. So those agreements with the manufacturer and making sure that there is a clear memorandum of understanding, having them urgently when you need them, are also part of the roles and the responsibility that the hub plays on behalf of the countries. So I just want to emphasize that to address a bit on the question related to vaccines. And also there was a question I addressed in the Q&A related to vaccines having a short expiry date. And as we are having a rolling stock, for example, like during the COVID, we have similar issues with the VTM, that some countries have more and other countries, others have not yet come in. So these VTMs was actually coordinated and moved quickly to countries that actually really needed it. So the same applies to some of these supplies that on this question that has been raised. If it is at the hub level, as it's a rolling stock, they have a bigger picture, so they will be able to coordinate with other countries that can actually coordinate and to be able to utilize it than it getting expired in your hands. Thank you. I see Fatima.
Thank you very much, Alex, for the clarifications. Fatima, next, just you'll come in with the the clarifications and go ahead to give the next steps. But let me see if there is nobody else among the panelists. I think you can come in to give your clarifications, so to respond to questions, and then go ahead to give the next steps. Let's have Mariam first, Dr. Miriam, then you will come into, and then you continue to give the next steps. Dr. Miriam, you're welcome.
Yeah, I just wanted to highlight, there was one question that was asking whether the hub is for storing for countries, like we give money and we buy and store, or it is for buying and donating the purchases to the country. I want to say, Fatima will add, but it is for both. You can get your money, buy and keep there, but the hub will also have money to put some for supply, for supporting some countries. And Fatima, you can highlight on whether the hub is storing vaccines that has come on many times, and also the system, whether there is a plan to build country systems so that they are able also to manage logistics well. Over. Thank you.
Yes, Fatima, please come in to answer the questions and go ahead to give the next steps for the region.
All right, thank you very much, Dr. Miriam, Dr. Otto. With regards to vaccines, this is an emergency response hub. When we keep anything related to emergency response, not routine work. That's number one. To allow us to remain nimble and agile for emergency response, we're not in routine work, but if it's a vaccine, it's something related to emergency response, we're there. I wanted to chime in on, to add to what Alex said earlier about different strategies for stockpiling. One, which is my personal favorite, is vendor managed inventory. This is where you make agreements with vendors and you own goods on the production flow. So let's say Ringer Lactate. You find a vendor that manufactures ringers and you make an agreement so that anytime you need ringers, they are ready to ship from there to the last mile. So what happens here? This is what I would do when I'm managing short shelf life items or items that requires special handling, temperature control, sensitive items, something like that. So next steps. One, you can see this is a conversation that will never ever finish. It's a very, very long conversation. I'm pleased to announce that WHO Afro, as I said earlier, is working very, very closely with the Africa CDC. And we have launched a joint action plan for emergencies in the area of logistics. We're working very, very closely with them. And one of our key goals is to strengthen the capacity to respond to health emergencies in the member states. So we're going around scoping missions, doing assessments on supply chain and operations capacity, doing emergencies on the end-to-end supply chain. We're also looking at capacity building in terms of trainings and on-the-job training. Dr. Nima can tell you that we had the scoping missions completed so far for 19 countries. And these countries that are scoped, those people that are identified in specific areas then get specialized training. And in fact, we are then using those participants of our specialized trainings to respond to health emergencies when they occur. Dr. Nima in Malawi, when she had cholera outbreak around April this year, we were able to send three, one woman, logistician from Ethiopia, health logistician / colonel in the Kenyan army, and also a health logistician from Botswana to support the response on the ground, working very, very closely with WHO. This is the surge team. And so there's a lot happening. We're also, of course, working very closely with our countries to help them in prepositioning, quantification training. Constantly, Alex just on my team, he just told you he's in Ethiopia. I'm sitting in Sierra Leone. My PhD farmer right now is in Botswana, doing capacity building in the area of logistics and supply chain. There is a lot of work going on as we continue to try to build health security on the continent. I'll stop there. And we want to hear from you. We keep open lines of communication with our member states. Our job is to help you do your work better at the last mile. Thank you very much. Over to you, Dr. Otto.
Thank you very much, Fatima, for very elaborate next steps. There's a lot of work to be done. And at this juncture, we are going to have closing remarks from Dr. Miriam Nanyunja. And please don't go away after our closing remarks. Ensure that you fill in the evaluation, and then we'll be able to send you the slides. Dr. Miriam will also request you to thank our panelists, the WRs for the countries, and also the participants from across the WHO Afro for getting time to attend this webinar. You are most welcome, Dr. Miriam.
Okay, thank you so much, Dr. Ito. Thank you to all panelists who have made this webinar possible, for sharing your experiences and your knowledge. In a special way, we want to thank the WRs for taking time from their busy schedule. I know that Dr. Nema is gone, but people from Malawi country office, please extend our thanks to Dr. Nema for sparing time to come and address this webinar. We thank you, Linda, for representing Dr. Brian. We appreciate his willingness to participate in this seminar, and all the other panelists. We want to thank you. We want to thank you, the audience, for being very attentive and for taking interest in this very important, this is a very important part of our emergency preparedness and response. So we want to thank you for being very interested in this. And I think this is just a beginning. If there are issues that I have noted here from many participants' questions, the issue of how do we know what to stockpile? How much of it do we stockpile? How do we ensure it doesn't expire? And all those are questions that need answers through training. So as you heard, one of the key issues that Fatima is talking about is capacity building. So there's a lot of work to do in capacity building for logisticians. And there's need to have logisticians, the expertise, as part of our emergency and preparedness teams. Just the pharmacists and people that manage drugs are not enough. So we need to have trained logisticians to be part of our emergency preparedness and response teams. With that, I want to thank you all for your attention and hope that the information shared will be used by many of you to enhance the preparedness through stockpiling for anticipated emergencies. When you have stocks for anticipated emergencies, even when the unanticipated come, often you can start off with those. Please make sure that you use the hub. The hub, the logistics hub, is here to help us to respond faster to our emergencies. So we really have presented it to you so that you can use it as much as possible. The team is willing and available to support you both in preparedness, prepositioning, but also in ensuring immediate and timely response. With that, I want to thank you all and declare this webinar finished. Have a good day, good afternoon, and God bless you all.
Thank you. There will be, the evaluation will be sent with an email, in a follow-up email. So the webinar has been closed. Thank you for attending.